Is that okay?
Lovely. Yeah,
Right.
good.
Fab. Get yourself comfy. If you want to move around, go get yourself a cuppa. I will not be offended. That's what I would be doing if I was on this call. Can't beat a nice cup of something warm when you're doing this sort of thing. Right, so welcome. So welcome to my Fix Your Knee Pain Masterclass. I'm hopefully going to give you some valuable takeaways as to how to manage your knee pain or stiffness or swelling a little bit better. So that's what we're going to talk about today. So for those of you on Zoom, you are already muted. You've already got your cameras on, which is fabulous. Facebook, you're not live with me, but what I would love you to do, those that are watching on Facebook, is comment as questions come up, and then I will go back into the recording and I will answer your comments directly. So if there's anything you don't understand or disagree with or whatever, then please raise your hand and I will come back to you. Those of you on Zoom, there is a chat box, so you can type or comment as you go and I will see them, they'll pop up, but at the end we're going to have a chat anyway, so you can save them for then or you can just type as you go. So no question is a silly question, just if you're not sure, ask for sure. Okay, so you guys know me already, but in case you've never met me before, I'm Becky. I'm a mummy and a wife. That's my most important job. But I am also a physio of around 20 years now. And I've been in the fitness industry even longer. My expertise is Pilates and exercise rehabilitation. And anyone I work with from an exercise perspective, my thing that gives me the most joy is helping people to improve their injuries and reduce their pain through using exercise. So that just gives me the utmost joy. And I'm hoping that I can share some of that wisdom and learning with you today. So my mission is to empower whoever I'm working with to manage their pain or injury or niggles themselves without relying on hands-on treatment. So I'm a physiotherapist, so I treat people hands-on in clinic, and that can give you some most beautiful relief, but it's not long-lasting. So teaching people how to make that relief last longer through using exercise, to minimize the amount of medication that you're on to manage your pain, ideally none if possible, and to minimize the need for medical interventions. So if we get you stronger and get you exercising, there's less likelihood that you will need medical interventions to assist with whatever pain or injury that you're dealing with at the moment. So this is what we are going to be working on today. So we're going to talk about swelling because it's a really important topic around the knee. And if you've currently got knee pain, you may well have knee swelling as well. So how best to get your swelling under control if you're not sure how to already. How to manage your knee pain better. And we're going to talk a little bit about why we get knee pain and how we can target all of those issues to reduce the knee pain. We're going to talk about how to instantly reduce stiffness around your knee. And then I'm going to talk through my Fix It Fast framework, which I use with all different injuries. But we're going to talk about it in relation to the knee and how having a step-by-step framework to follow can make your rehabilitation and your exercise much more simple. Okay, so that's the plan ahead today. Now, before we get going on, this is a rather grim looking slide, I know, but I do have to go through this with you. When I did my back pain masterclass back in June 2 years ago, this slide prompted somebody to go off to A&E, and she ended up having surgery the next day. So really important that we just quickly cover the red flags, just in case there's anybody watching this that this is relevant to. So usually when we see knees in clinic as a physio or as a doctor or as a health professional, usually it's a wear and tear issue. Maybe it's someone that's had an accident, there's been some trauma, but sometimes it can be more concerning things, and they're the things we want to rule out before you go through this presentation. So the things that really concern us is there a blood clot in or around your knee? Have you got an infection? Or is there something more sinister going on? something more nasty, and we need to rule those things out. So if your knee is very red, hot and swollen, and you haven't, and that's an unusual thing for you, you've not been maybe diagnosed with a rheumatic thing in the past, if it's come on quite suddenly, if you've got a temperature, if you've got unremitting pain that's not movement related, particularly if it's there at night, then it is a medical emergency, and we do need you to go and get checked out by, if we're concerned about clot, it's straight to A&E. If not, it's straight to your GP. So the things that we worry about an infection in the joint. It's very, very rare, but it can happen. We worry about blood clots, so DVTs. And there are other things underlying that can be going on with your bones that are not physio-suitable treatment-wise. So I just need to go through these to make sure that you're safe to proceed. So if you are getting fevers, if you've got any cellulitis, which is an infection in your skin, then that's something that you need medical assistance. And cellulitis and a blood clot can look very, very similar. So sometimes it's hard to know, and that's when we need to go off to A&E and get checked out. So just be aware of those symptoms. Right, what causes knee pain? So I know some of you with me today have got autoimmune conditions, and so then you have an immune system element to your knee pain. But when I'm in clinic, most of what I see is what we would call mechanical knee pain, so wear and tear. And whether you do or whether you don't have an inflammatory disorder like rheumatoid arthritis or something similar, you will still have all of these things going on with your knee. So once we've ruled out anything serious, so an infection in the joint or a clot or something like that, then the majority of what I see in clinic, these are the 5 causes of knee pain. So these are the 5 things we need to address where possible. So the first thing we're going to be talking about today is swelling. And swelling happens when there's an injury or where the way that the knee is moving is not optimal, and you're causing rubbing, wear and tear within the joint. Swelling happens to protect the joint. So it's an inflammatory reaction, and it's trying to protect your knee and stop you from maybe moving it as much. But what swelling does is it makes you less able to move your joint. It makes it more painful and stiffer, and it also switches off your brain's ability to activate your muscle. So if you have swelling around your knee cannot operate normally. So one of the most important things that we could do is get rid or get the swelling down as much as possible. Now, where possible, I like to do this without medication. Some of you I know will be on anti-inflammatory medications for health conditions, but today I'm going to talk about how we can do it without medication. So what we can do to reduce our swelling. So that's one of the biggest causes of knee pain. Once you get the swelling down, usually people are much more comfortable. So that's the first thing we're going to talk about. The next reason is kind of linked with point 4. So when you get wear or tear around your surfaces of your bone, your cartilage, which is like the top surface where your knee joints connect, and all the bone that's underneath the cartilage, when you get rubbing and wearing of those surfaces, then swelling within the joint can occur. So most people I see in clinic, they haven't had an acute injury, they haven't necessarily fallen over and hurt their knee. I mean, I do see that, but it's less common. Most of what I see is wear and tear injuries over time. So even if you do have an inflammatory disorder, it's wear and tear and the way that your joint is moving that is causing swelling and therefore causing pain. So when you've got wear and tear in a joint, you get swelling and you get stiffness, and then the joint maybe doesn't move the way it used to move, and all of those things cause an increase in your pain. So where possible, we're going to try and undo some of that. Stiffness, number 3, can be linked to swelling. It can be linked to changes in your bone or your cartilage, but also it can be due to lack of use. It can be due to the soft tissues getting really tight. And I tend to find in clinic, if we deal with the tension in your soft tissues, so the tissues on the surface around your knees, we can make your knee a lot less stiff instantly, and therefore your pain comes down instantly. So in clinic, one of the things that I do is I release with my hands the muscles in and around my client's kneecap. So usually in the lower part of their thigh. And usually, because I measure their knee, how much it bends and how much it straightens, pre and post treatment, we can get an instant increase in range and an instant decrease in stiffness and pain. And I'm going to teach you a technique that you can do to yourself to do that at home, because it's not practical to come in and see a physio every time your knee stiffens up. Want you to be able to deal with that yourself. So stiffness is really linked with swelling, and it's really linked with bony wear and tear, but it's something that if you work on it, you can improve it, and the same with the swelling. Point number 4, poor biomechanics. That's how you move. And we all move slightly differently. You might be able to tell your friends and family from the back just by the way that they move, because they have a certain movement pattern that you recognize. And we're going to talk about that in a little bit more detail and why that's so important to managing your knee pain. Improve the way you move, decrease your pain. And then the final thing that is really, there's a lot of research studies to back this up. If you lose muscle in your thighs, your chance of knee pain massively, massively increases. The irony of this being that if you are swollen or stiff, your nerve conduction to your muscles in your thighs is not as good. Things don't fire as well, which is why exercise is so important, because we don't want those muscles to be lazy and relaxed around the knee. We want them to be strong, and we want them to be switched on. So if we can reduce your swelling, if we can reduce your stiffness, if we can improve the way you move, and if we can wake up your muscle first and then maybe build some muscle, those 4 things will reduce your knee pain. And that's what we're going to talk about a little bit today. Today, I'm going to talk to you less about the how we're going to do that, because I'm going to be covering that in following weeks in my knee course. But I'm going to talk to you about the principles and why it's important, and it might inspire you to go on and make a change. So that they are the key elements of what causes musculoskeletal, so in your bones and muscles and joints, knee pain. Okay, let's talk about swelling. So swelling is something that we can get acutely. So if you walk into something and bash your knee, you can get swelling. If you fall on your kneecap, you can get swelling. But also you can get chronic swelling because you've got wear and tear in the knee. So how do we address that? So my number 1 favorite thing that always really surprises people when I suggest this in clinic is not ice. It's actually submerging whichever joint is swollen fully in water. I find it is the least painful way of reducing swelling, and it is the quickest way of reducing swelling. When you ice something, you cause all the blood vessels initially to constrict. But if you ice something for too long, they then dilate because your body thinks that that part is freezing and you might get frostbite. And actually, sometimes it can make the swelling worse. And also, if you've ever had a really acute injury, like the time I dropped a 20-kilo plate on my foot and smashed it, if you've ever put ice on an injury that acute, the pain is unbelievable, because the ice stimulates your nerves and heightens the feelings of pain. So for some people, when they pop ice on, it can make things far more painful. I couldn't let an ice pack anywhere near me when I decided to smash up my foot. Not intentionally, but a minor accident that happened in the gym. So the best and the kindest way, as long as your skin is intact, you haven't got any recent wounds, is to submerge in water. So any kind of water, like swimming pool, bath, bucket, depends on what joint it is and where it is. For the knee, obviously, it's much more tricky than, say, a foot or an ankle, but you want to fully submerge that joint in water, and you want to stay in the water until your fingers or toes go wrinkly. So when you're in the bath or in the swimming pool and your fingers or toes go wrinkly, it's because the fluid, the tissue fluid within your tissues has been pushed back into your circulation. Yeah, which is why, so when you're in water, the hydrostatic pressure makes your kidneys work 8 times faster, which is why you're always desperate for a wee after you've been in a swimming pool, right? It flushes water out of your system. So if you're struggling with water retention or swelling, if you get into water, it is the quickest and most effective way. So that is my first number one top tip. If you're getting problems with swelling, get in water as often as possible. You don't even have to do anything in the water. You can sit in a jacuzzi and have a nice drink. It will still do the same thing. If you're moving in water, it's going to flush it out quicker, and it's going to decrease your stiffness. So if you're walking in the water or anything like that, that's going to be even more helpful. But just being in water is so, so helpful. So whatever your joint that is the problem is, get it fully submerged. That's my number one top tip. Let me quickly talk about the RICE protocol, which I'm sure many of you would have heard of. So the first thing is rest. So if you've really acutely hurt something, or if something's very, very painful, generally, if we don't move it and we rest it, it feels better because we're not irritating it and inflaming it. Rest is good up to a point, but actually rest can also be harmful because it deconditions us. So it's good when something's very, very acute, but long term, it's not a practical solution. We've spoken about ice already. The best way, if you're going to use ice, is to contrast bathe to reduce your swelling. So contrast bathing means you pop a cold pack on it for up to 5 minutes, no longer. Then you take it off and you put something hot, like a hot water bottle on it, and you go hot, cold, hot, cold. That is better than just keeping ice on it. Yeah, ice is only a short-term solution that should really be for no more than 5 minutes. Okay. Like an ice bath like this chap in this picture is doing, it's very effective. He's got the submersion in water and the cold, so that's even more effective, but it's not terribly comfortable. So if you aren't going to get in water and you're going to go for ice, try and do hot and cold, so contrast bathing. All right. Compression, so some people might wear tubey grips, compression socks, those sorts of things. They can be really useful. They're not a long-term solution, but they can be useful. Water is better. If you are going to wear a compression garment for your knee, it really needs to be compression leggings, ideally. You can get leggings called skins. You can get socks as well, but it needs to go right over your knee and right under your knee, and not really dig or cut into anywhere near the joint, because we want the blood flow to your knee to not be compromised in any way. So you can buy sports leggings that have got built-in compression. That's probably the best thing. And if you're going to get a tubey grip, I'm just going to show you my, in fact, let me just stop sharing for 2 ticks. If you're going to use a tubey grip, it needs to go from here to there. So you might as well wear a legging, right? These little tubey grips that are like here, that's no good. You get some knee supports that are maybe here to here, but they tend to roll up and roll down. So I just tend to find that they're not really a long-term solution. They're good for short-term support if you've got to go for a walk or do some sports or something like that, but it's not really a long-term solution. Okay, the other thing is to elevate. Now, a lot of people, they just put their feet up on their stool by their chair, but actually the best way is to get your feet above your heart. So if you are mobile enough, if you're really struggling with swelling, particularly if it's pooling, because with knee swelling, it can actually pool around your ankles as well, make your ankles swollen and stiff. The best way is to get your bottom against the wall and get your feet up on the wall, so you're almost at 90 degrees if you've got that degree of flexibility. You can do the same thing on your bed with your feet up on the headboard, and actually keep your feet up above your heart. The higher your feet, the quicker the swelling drains, and therefore the quicker the relief that you get. So feet up, so on the sofa with your feet up is better than feet down on the floor, but if you can get your feet up above your heart, even better for a prolonged period of time. So there are the things that you can do to reduce swelling. My number one top tip, if you don't do it already, get in the water and fully submerge much more than you currently do, and that will massively, massively change your ability to move your knee, bend and straighten your knee, and it will reduce your pain as well. So getting in the water is incredible. Okay, so that's the first thing, swelling, done, tick. Okay, so why are your joints stiff? So one of the reasons your joints might be stiff is actually just the fact that you've got swelling in there. And that your swelling is going to prevent your joint from being able to bend and extend properly. But also, our tissues change a little bit with age. So our cartilage gets a little bit drier and stiffer. A lining of our joints. So every joint has a lining around it, and that lining, as we move, produces fluid that lubricates the joint, and that joint lining tends to produce less fluid as we age. So I'm in my 40s now. I'm significantly stiffer than I was maybe in my 20s. And you notice that there's a change in your tissues, and that maybe if you've been sitting still for too long and you get up, things are feeling really tense and stiff. Another reason can be because your muscles are weaker than before, or you're not moving as much as before. So when we're still in our sleep, again, things tend to stiffen up. When you've got a painful joint, like a painful knee, your body tries to protect that knee by just tightening all the soft tissues on the surface. We're going to talk about that in a minute. So your skin, your fascia, which is like a connective tissue that joins everything together, and the muscles in and around can really kind of tighten to protect the joint. But actually what that does is can often cause more pain and stops your muscles from moving properly and contracting properly. So stiffness is something that we definitely should address, and we can address that with moving more and by doing some release work, which we're going to talk about in a moment. We do get stiff because we get wear and tear in our joint surfaces, and if anyone's got quite severe arthritis, you can get bits of bone that stick out called osteophytes, and they can stop your joint from bending and straightening properly. That's not something that we can work with exercise wise. You may need surgical intervention there, but the more we improve the way you move, hopefully the less wear and tear you'll get in the first place. And then also we've talked about swelling and inflammation already. Okay, so this can be a bit of a hard pill to swallow. So the number one cause of your knee pain, unless it's been acute and quick and traumatic, is very often us. Okay, so that shouldn't say back pain, that should say knee pain. Forgive me. So the way that we move, our habits, our postures, our favorite things to do, our body weight, the car we drive, the sofa we sit on, all sorts of things can affect how our joints are feeling and operating. So if you used to love to run, for example, you may experience a quicker rate of wear and tear in your knee joints than someone who maybe didn't run before. And sometimes our knee pain can be due to an inflammatory disorder, or can be due to a traumatic instance like a ski injury or an injury in the gym. But within that, there are so many things that we can do to modify the way that we move that can positively influence our knee pain. The biggest cause of knee pain is loss of muscle mass in your quads, your thigh muscles. So even if you are struggling with a prior injury from a traumatic incident or an inflammatory disorder, all the things about habits, postures, hobbies, and losing muscle mass still apply. So that's something that we can do to change your knee pain. Oh, hang on a minute. In fact, yeah, let's talk about that first. That was not meant to be there, but let's talk about that. So on the topic of habits, something as trivial as your footwear can make a massive, massive difference to how your joints are feeling, but also how your knees are functioning. So this little slide was going to be a little bit further on. it shows a pair of normal shoes. So these shoes here are actually a pair of Vans, which my kids have got. They're just flat trainers that seem pretty sensible. Can you see what this does to your foot and how it squashes your toes together? Now, in the last 2 years, I've transitioned to barefoot shoes. This is a barefoot shoe, and I appreciate it might look like a bit of a comedy shoe with a very, very wide toe box, but can you see the difference that this has on your feet? So pretty much every shoe that you buy in the shop that's not a barefoot shoe, this is what is happening to your feet. Even if it's a sensible shoe like a Skechers or anything that you can buy commercially on the high street, this is what is happening to your feet. And that is actually very, very relevant to your knee pain. Because if your toes are being squashed together, this joint here, your big toe joint, cannot bend properly. And this toe is being pushed against your second toe, and it causes over time bunion formation and a stiff big toe joint here. If that big toe joint's not moving here, it affects what happens at the back here at your ankle. Your ankle can't move quite so much, and then that will have a direct effect on how your knee is moving. We're going to talk about that in a minute and biomechanics in a minute. But I am in recent years massive fan of transitioning to a barefoot shoe because it's a really simple change that you can make to your day-to-day life that gives your feet more space. It does take a while to get used to that transition. But if you've got more space for your toes and a stronger foot, because this will make your foot stronger because there's more space in between the bones for your muscles in your foot to develop, it will positively affect your knee pain. So your footwear, your habits have a massive, massive effect on your joint pain, okay? Right, good news is you can do something about many of these things. We can improve our swelling, we can improve our stiffness through exercise, we can get ourselves stronger if we set our mind to it. We can't change inflammatory conditions, we can't change the trauma that we've had in the past if we've had a real injury to our knee. But a lot of what causes knee pain, we can actually change ourselves. So I hope that it's a positive message that something can be done regardless of what's going on with your knee. So the two things that we're going to talk about now is, number one, reduce the exposure to things that hurt your knee. So work out what are the things that really set you off. And for the short term, we need to avoid those and do a little less of those. So for example, if kneeling hurts your knee, is there a way of kneeling with some cushioning or padding underneath your knee? When you do Pilates with me, if you've ever done that before, when we go on all fours, I give options where we can support underneath the shins so that the kneecap isn't jammed into the floor when we kneel. Sitting on a slightly higher chair, for example, if it really bothers you getting out of a chair, can be really helpful on reducing the strain short term on the knees. Walking up and down the stairs, if you're in too much pain to go one stair at a time and just walk one foot and then the other, sometimes for the short term we have to go up two foot on one stair and so on. But that's not something we want to do long term. But for the short term, we need to think about what are our real triggers and try and avoid them, because the more we inflame the knee, every time we inflame a joint or an injury, it takes 6 weeks for that to settle down. So it's just about being really mindful about what are your triggers, making a note of them, and thinking how could you modify that. This is not a knee example, but a back example. A lot of people's cars set their low backs off. In fact, let's talk about knees and the car, right? If your car seat is too close to your pedals and your knees are therefore very, very bent, that can really irritate sore knees. So sometimes something as simple as sliding your seat back slightly more, as long as you can still reach the pedals safely, can make a massive difference. Another thing that can make a massive difference, and the same with back pain, is elevating your seat. So if you're able to elevate your car seat, you can on my car seat, and lift it up, be higher on your seat. If you can't do that in your car, get a cushion under your bottom. So think about what are your triggers, and is there anything you could do to modify and reduce some of those triggers? And then the other thing is, and this is the thing that this is my baby, is to reduce the stress at the site of where your pain is by teaching your body to move better. And that's what we're going to talk about quickly now, okay? So, right. we're not going to bother with all the writing here. All I want you to know is that your body is like a tower, okay? And your feet are the base of this tower. And everything else is stacked on top. So if there's something misbehaving at your foot and at your ankle, then it's going to have a direct effect on how your knee is behaving. And if you've got weakness around your hip, then it's going to have a direct effect on how your knee is behaving. So more often than not, when anyone comes in to see with knee pain, there's a problem at the big toe, the ankle joint, the hip, or all three things, okay? And that's something I will go through in much greater depth in my knee pain course. But know that how your hips and your feet are behaving directly affects the amount of pain that you have in your knees. This is something we can change, okay? Let's just have a look at these gorgeous knees, right? So this is the optimum. This is where we want to be, here in the middle, all beautifully lined up, and kneecaps are pointing forwards and hips aren't turned in and out, and everything's doing what it's meant to do. But very few of us are like this person in the middle. We're all a little bit wonky, and one leg maybe sometimes does something a bit different to the other leg. If your feet naturally turn out a lot, it generally makes your knees turn in. And it also makes your hips turn in. So you're a bit knock-kneed. And what that does is it causes quicker wear and tear here on the inside of your knee. So the inside of your knee will wear quicker. So what we would have to do for someone who is like that, we've got to get your hip and your bottom stronger. We've got to teach you better balance around the ankle, and we've got to make sure that your big toe is moving better, okay? So what is happening above and below affects what your poor old knee is experiencing. So yes, we need to work around the knee, but actually what's above and below it is just as important. And then this person over here, we see this less. People are less likely to be like this. But if you're kind of quite bow-legged, maybe genetically, or if you've had a condition as a child that makes you more like this, that will put more stress on the outside of your knee, and you'll get more wear and tear here. Now, for some of you, your pain might not be in your big knee joint. It might actually be in your kneecap joint. Can you see that little bit of bone in the middle there at the front? Those teeny tiny little bones. That's your patella, that's your kneecap bone. And if your knees do this and roll in, it tends to be the inside of your kneecap that gets the wear and tear. And if you're a bit more like this, bow-legged, it tends to be the outside of your foot, of your kneecap that gets wear and tear. Not always, it depends what else is going on. But what a foot and what the knees are doing and the hips are doing has a massive effect on how your knee is feeling and behaving and how swollen. You are less likely to have swelling if you're more like this than you are if you're like this and that, okay? So if we can improve the way you move, amazing. So this is my framework. You may or may not have seen it before. This is something we're going to briefly discuss today. So this is my 6-stage method of getting my clients back to as close to pain-free as we can possibly get them. So we start at the very beginning here. And if you've ever heard me talk about spiky balls, because you know I'm obsessed with them, that's this stage here. It's all about reducing tension in the tissues on the surface. So your bones, not your bones, your skin, your fascia, your connective tissue, and your muscles that are on the surface. When people come in with a stiff knee, the main cause is tight tissues or swelling. They're the main cause. Some people can't bend or straighten their knee because there's something happening inside their knee joint. But for most people, if we sort out their swelling and we sort out this tension on the surface, suddenly they can bend and straighten their knee with much more ease, particularly bend the knee if you're not very good at bending your knee, if you're restricted that way. And then that translates into immediate reduction in pain. And I'm going to give you a little bit of homework to go away with a video and practice releasing around your kneecap. We're going to talk about that in a minute. So articulate. These are exercises that get stiff bones moving. And for the knee, very often these exercises aren't just knee exercises. Very often they're related to your big toe, if you've got a bunion or a stiff big toe. So your big toe is so important, how your big toe joint moves. It affects directly your ankle and your knee. So we want to make sure your hips are moving well, your ankle is moving well, because if your ankles are stiff, it increases the stress on your knee. You want to make sure that your knees have got full movement and your big toes have got full movement. So for knees, everything above and below is super important. Your activation exercises, if you've ever done any Pilates with me, everything we do in Pilates is pretty much in these 4 stages here. We might be spiky balling, we might be doing gentle mobilization exercises, we might be doing waking up exercises. These might be for your bottom, they might be for your thighs at the front or at the back, they might be for your inside thighs, they might be for your ankle muscles. So anything we do balancing is an activation exercise. And so for the knee, we would work around the hip, around the ankle, and all the muscles that surround the knee. So the front and the back of the thigh, the inside thigh, and your calf muscles. Stretching, I'm pretty sure you can work out what that is. If there's tight muscles, it's good to stretch them. But when you have a lot of knee pain, it can be very difficult to stretch them. If you've ever done a quad stretch, which is the one where you stand on one leg and you hold your foot and bring your heel to your bottom, that is almost impossible if you're very tight, stiff, or painful in your knee. There are ways around it, but that's why stretch is so much further down the line than over here, because everybody can do this. Everybody can do this, and you can all do this pain-free because you don't have to be on a floor, okay? So we're releasing with spiky balls or foam rollers or tennis balls. We're doing gentle mobilization exercises. We're doing gentle exercises to wake up lazy muscles. We might be using maybe bands or stuff here. We're stretching. And then the final piece of the puzzle is strength work. Integrate is just you getting back to normal life. But this is where a lot of people fall off the bandwagon, but actually strengthening is where we really need to focus. There was a study done recently that shows that the strength of your quads is the biggest indicator of high or low mortality. So how long you are to live. So basically, it kind of makes sense. Think of a very elderly, frail person. When they lose their ability to get out of a chair with ease, do the stairs, and walk around, that is all relevant to the strength of their thigh muscles, right? When they lose that ability, that's when they start to lose health and function more because of frailty. So if you can keep your thigh muscles strong, you will not only reduce your knee pain, but you will, by research says you're going to live a longer life. So what's not to love about that, right? It's incredible when you look into the research, but it's so important. And you know, if you are a younger person watching this and you haven't experienced any muscle loss yet, you might think that sounds a little bit ridiculous. But I noticed myself, even through pregnancy, how much muscle mass I lost in my thigh muscles and how suddenly my knees got sore as a result. It's incredible the difference it makes. So this is my framework. Hopefully that makes sense to you. Right, let's talk about a bit of homework. I'm not going to show you how to do this today, but I'm going to give you a video how to do this. So step 1 on my framework is the inhibition. Okay, another rather long word for inhibition is self-myofascial release. In other words, release it yourself exercises. We can do this on foam roller, like this person releasing their bottom. I don't like about foam rollers, they're too big and they don't get deep in enough, and they can actually be quite hard work to get on. You can also use things like tennis balls. Sometimes they're not hard enough, sometimes they don't give you enough relief. I love a spiky ball. We're going to talk about that in a minute. But basically, self-myofascial release, we're using your body weight and gravity to release something yourself. If you own a massage gun, and a lot of people do nowadays, you can do the exact same thing with a massage gun. It is much cheaper than a physio or a sports massage, okay? So it's something you can do yourself daily. So I am going to give you a video to do. In fact, I'm going to send you 2. And this is your second bit of homework. So the first one is to work on reducing your swelling, ideally from submerging in water. Your second piece of homework is to do these 2 spiky ball exercises. Now, if you can invest in a pair of spiky balls, go for Sissel, go for the smallest size that are yellow, and I think they're about 8 centimeters across. They can be pumped up or pumped down because they've got like a little bicycle pump hole in them. So you can pump them up if they're not hard enough. The spikes grip your tissue and make things release a lot quicker. But if you don't want to invest in those, you could use tennis balls or something of a similar size. If you wanted something really hard, you could go for like a baseball or a cricket ball. This is going to be much more aggressive than a tennis ball. And my favorite is these. You can do so much with these, as some of you know, because you've used them with me quite a lot before. I'm going to put in the Facebook group 2 videos. They're already there, but I will pop them at the top so that you can find them. The first one is how to release around your kneecap. That will reduce your kneecap pain, but it will also help you bend your knee if you're really struggling to bend your knee at the moment. So that's the first bit of homework that I'm going to give you. And then the second one is one I did quite a long time ago, was release for the calf. Now, if you're really tight in your calf muscles, particularly at the top near your knee, around the back, right? That can really restrict your ability to straighten your knee. So if you're struggling to get your knee fully straight, which some of you are, sometimes releasing the calves can make a massive difference on how well you can straighten your knee. So releasing your quads, your thigh muscles, can help you improve the bending of your knee. Because when you try and bend your knee, that's what you're going to feel pulling. You're going to feel your thigh at the front pulling, and you're going to feel across your kneecap pulling. And then the calf muscles at the back, they're going to potentially be restricting you from straightening your knee fully. So that is piece of homework number 2. Okay. And I will, if you're in the Facebook group, I'm going to highlight those videos and pop them at the top so you can find them nice and easily. You can let me know what you think once you've had a go. I'm not going to say it's comfortable to do, but the more that you do it, the less it's uncomfortable, and you will see a direct improvement in your pain. Now, one little side note, if you do this release and you feel very bruised after, some people, if you bleed easily, might even look bruised. That's quite unusual to see bruising, but you might well feel it to touch. You need to wait for that feeling of bruising to the touch to ease before you do it again. Okay, so the more you do it, the less it will feel bruised after, and you'd be able to do it daily if you wanted to. But if you haven't done any release work or had any treatment from a physio around your knee or calf in a while, it might feel like a very strong feeling, and you could feel bruised to the touch afterwards. So just let your body heal that feeling of bruising and before you do it again. Okay, so that is assignment number 2. Okay, the final thing we're going to talk about today, and I'll be as quick as I can, is strength training. We've already talked about how important it is to strengthen your quad muscles. I'm not going to talk about specific strength exercises today, but the number one exercise, the number one muscle you need to strengthen is the front of your thigh. And then after that, we need to think about the muscles at the back of your thigh. We need to think about your bottom muscles and your calf and ankle muscles. Okay. But if you could just do one exercise or focus on one thing, it's the front of thigh, and make sure that they are firing better. Okay, so if you go to the gym or do any exercises and you know you're targeting those muscles, keep going with that. This is such an important slide. Why does this matter? This is mildly depressing. Right? So from the age of 40, I am now 40, adults lose 8% of their muscle mass every 10 years. Okay, so the older you are, the quicker you lose your muscle mass, unless you do something to preserve your muscle mass. So we have to be challenging our muscle strength. And how we do that will vary from person to person. If you're a very frail person and you're struggling to get out of a chair, then just practicing getting up and down from a chair is as good as any gym exercise. But if you can easily get up and down from a chair and you can easily climb up and down the stairs, then you need to be focusing on exercises that are more challenging. And ideally, we want to get you in a gym where you can use resistance equipment that specifically targets the muscles that we want to focus on. There are many, many exercises you can do from home. But to really see a gain in mass and muscle, or to prevent you losing what you already have, which for most of us is the main concern, rather than really feeling a need to build more, we've got to really challenge those muscles regularly, at least 2 times a week. Okay. If you do Pilates with me or you do Pilates with someone else, that is not enough to challenge. So Pilates wakes stuff up. It gets your brain connected with the muscles, but it does not stimulate your muscles enough to preserve what you have and to grow what you have. Okay. And the older we are, the harder it is to grow. It's taken me 3 years of working really hard to get my quad muscles back after pregnancy. And it definitely wouldn't have taken me 3 years 10 years ago, you know? So it's so important that we exercise to maintain mass of our thighs. So why does this happen? It's loss of muscle. It's a natural part of our aging process. There's so many reasons why it might happen. Maybe you don't move as much as you used to. Maybe you have pain. For some of us, as we go into perimenopause and then menopause, hormonal changes will have a massive effect. For men, their testosterone drops and therefore they lose muscle mass with much more ease. You might be on medication that messes around with your hormones and can cause you to lose mass. Your gender has an effect. So us ladies lose it quicker, and we put it it's harder for us to put it on because of we've got different hormones floating around in our system. It also can be very genetic based. If you come from a very stocky, muscular family, you're more likely to maintain your muscle for longer than if you're very slim and long and lean. So there's so many different reasons why, but for most of us, it's a drop in activity levels. Do you move around as much now as you did in your 20s? Probably not. And certainly not for me, even though I do still exercise a lot. And that has a natural consequence. For those, this is a random fact that I didn't know, but I think it's really interesting. So for those of us struggling with weight gain as we age, which it's always a challenge, isn't it? Right? Okay. Like look at a slice of cake nowadays and I can put on half a stone. So the biggest reason why we put on weight so much easier, it's a really big topic, but the biggest reason is because you've got less muscle fibers than you had 20 years ago, right? If you could get some of those back, it will raise your metabolism so you can eat more without gaining fat. And if you are pre-diabetic or diabetic, you will be able to control your blood sugars with much more ease if you had more muscle. So if there's one thing you can do, it is strength train. Yeah. I'm like cardio, I'm not interested in. Walking is fabulous. Swimming is fabulous. But I'm not interested in whether you can run or whatever. But strength training is the most important thing. And it's got so many benefits. We've already spoken about those a little bit. I won't go into those in detail now. So yes, so we're done now. So that's the end of today's session. So if you would like some more support, I would like to just tell you about this very quickly if you are interested. Even if you're not, you've got some homework, and we're going to just recap that in a moment that you can go away and you can implement today. From next Tuesday and for roughly 4 weeks in a row, but there's 1 week off for half term, I'm running the Fix Your Knees course for 4 weeks. And let me just quickly talk you through what we're going to be going through. So week 1, we're going to talk a little bit about what we've talked about today. We're going to go through how to release and spiky ball properly and make sure that you're doing it properly, and talk about some few extra techniques. So that's week 1. It's about releasing your tissues and giving you some pain relief. Week 2, we're going to talk all about hips. So how to get your hips moving better and stronger, because that has a massive effect on your knees. Week 3 is all going to be about specific exercises to wake up around your knees. So front of thigh, back of thigh, and maybe a little bit of calves. And then week 4 is all about feet. How can we make our big toes and ankles move better? And how can we get our feet and ankles stronger so that there's less stress going through our knees? So that's like a quick summary of the topics ahead. Now, there are 2 options if you do want to join me. You can attend live, which is via Zoom, and the cost is £300 if you want to do that. Or you can go for a recordings only option, because many of you can't make this time, 11:30 on a Tuesday, and that's half price because you're not getting my input and one-to-one attention at the end of each session. So if that's of interest to you, then do let me know. There is some money off, 25% if you sign up within the next 24 hours. So if you are interested, give me a shout and let me know. It'll be lovely to see you. Right, let's move on. Right, homework. So number 1, what can you do to reduce your swelling? Is it going to be getting into water? Is it going to be contrast breathing? Are you going to make an effort to lie on your back and have your feet elevated above your heart a little bit every day? So if you're struggling with swelling, what could you do? Or what things could you do daily or weekly to really improve your swelling and get that down? Okay. Number 2, do your knees fully bend and fully straighten? And is one knee significantly worse than the other? It would be good to just lie on your back and test how well it bends and stand up and see, can I get both knees fully straight? And make a little note, which knee is it and where are you restricted and is there any pain? So that's quite a good thing to do. Number 3, we've spoken about this already. I'm going to give you 2 spiky ball videos to watch and practice. Number 1 for your thighs, number 2 for your calves. Okay. I'd love you to then also just think about, how do you move? What do your feet do? Do they turn out? Do they turn in? Do your knees knock in? Do they turn out? Like how do you walk? Do your knees roll in? Do you wear down the outside of your shoe or the inside of your shoe? Is your big toe stiff? Do you have a bunion? Just consider how do you move? And then also think about your footwear. What is your widest footwear around the toe, around the front of the foot? And can you wear your wider footwear more? Because that would be so helpful. Okay. So they're your kind of 4 things. And then a 5th thing is, do you need any more support moving forwards with this? And if so, would you like me to help you? And if you would, let me know. Okay. So that's your homework. 4 things to think about: swelling down, have a look at your own knee movement, do the spiky ball exercises, and think just about how do you move and how could that be affecting your knee pain. And that's it. Thank you very much. Right, let me stop sharing with you. Bear with. I've got to try and get out of this now. How do I get out of it? Oh, there we go. Exit full screen. That's what I want. Come back. Come back, come back. There we go. There it is. There. Right, I want to stop sharing. There we go. There it is. Right, fabulous. Ladies, just got it in an hour. Just.
Well done.
Right. Okay. How are you both? And do you have any questions, comments?
I do.
Go on.
I bought some barefoot shoes. And they were okay doing things inside, but I don't like how thin they are. Can you get more padded ones?
Yeah. Can I disappear and go get mine?
Yeah.
I'll be back. You hear me rummaging. You can get different ones. I have some suggestions for that. Excuse me as I run through the house. So you're right. So there's 3 things to talk about, right? And Inez, you may never have seen barefoot. These are my barefoot.
No, I have seen them because one of our friends uses them. I can't tolerate them because I can't have my foot that flat. I can't even have bare feet in the house.
Yeah. And why do you think that is? What hurts when you do that?
I don't know. I just can't tolerate it.
Is it because your calves are really tight and so your foot?
Well, I've had foot surgeries because I've had both my bunions done, so I'm sure that has an impact on it. But I just can't. I need to have my arches supported. That's what I feel, and they are very flat, aren't they?
Yeah. Right. I'm going to get to that. Okay. So these are my trainers. I mean, look at them. There's nothing to them, are there? Like, it's ridiculous. Okay. So as wonderful as they are, I have never run in these. So the way that we're designed, and I'm not quite answering your question, but I'll get to it. When we run, so if I said, take your shoes off and run across the grass in your garden, you would not run heel toe. You just wouldn't.
No.
You would run on the middle part of your foot and round to your toe. So we call that midfoot strike. That's how we're designed to run. We're not designed. So the only reason we run heel toe is because somebody invented trainers with a massive, great big shock absorb. And so we have decided that's how we're meant to run because that's how our trainers tell us to run.
Right.
That's not how we're meant to run. Okay. But if you get your average Joe to go out and run across and do some running where we land midfoot, because if you landed on your heel in these, you'd end up with a stress fracture eventually, right? Okay. Our calves would be in pieces because we don't have the strength because we haven't built it up since childhood, right? Okay. So there is no shock absorb in these because that's not how you're designed to walk as a human being, because we're not designed to wear shoes with support and heels and all those things, right? However, we are the way we are, and we've worn the footwear that we have throughout our life. So how could we modify these? So the first thing you can do is you can get insoles that are just like foam padding.
Yeah.
So they're not support, but they're just like this much foam padding all the way down.
That's all I probably need because I like being barefoot.
Yes.
But what I found with those is that you could just feel too much of the every little gravel bit you
really can. And these, like, can you see they got holes in them?
Yeah.
So you can't go out in the rain in them either. Okay. So solution number one, because these are quite stretchy. Get a foam insert so you've got a degree of shock absorb. So that's tip one. If, like my mum, you've got really arthritic feet and you've had reconstruction surgeries, what I'm trying to get her to do is buy a size up and then put her insoles within these. So then she's got her foot support, but also she's got a much wider toe box. Yeah. But you will have to size up. Now, if you buy a more expensive band like Vivo Barefoot, I'm going to show you my boots in a minute. I think they give you something like 30 days trial. So you can buy a couple of sizes, try them with your insoles, see what feels best sizing wise. But then if they're not suiting you, you can send them back. These ones, Autopack, are from Germany, and like, they're a real hassle to return. So if you're not sure and you've not tried them before, I took a gamble on these because they're much cheaper. They were like 40 or 50 quid. And I need some more because they're falling apart. But yeah, so size up and pop your insoles in. I have a slightly controversial opinion on insoles. I'm not a fan unless you absolutely have to have them. So the way that insoles traditionally support is under the arch here, and that destroys your biomechanics. The best way with insoles, I don't know whether you can buy any off the shelf like this. I saw this, I was taught by an amazing podiatrist at university. And what he has designed is an orthotic that tips your heel and supports your heel. Right. So rather than supporting from the foot arch that just sticks into your foot and stops your foot from moving, he has an orthotic that tilts your heel like that. So if you're a roller inner, it will give you an orthotic that brings you into neutral, and then the rest of the foot is free. It's supported by the insole, but it's free to function as it should. So that would be the optimum type of insole to wear in these. Whether you can buy something like that off the shelf, I'm not sure. But I can give you his details if that's something you wanted to investigate. His name is Paul Paradine, and he is amazing. He does teach people to make them, and I keep thinking I must go on his course. But yeah, so if you imagine your heels roll in, which most of us do, if we can just bring the ankle into neutral, then the foot behaves itself. Whereas if you shove an insole into the arch of your foot, it weakens your foot and it exacerbates the problem. Okay. But if you've got bunions, the wider the toe box, the better. Let me show you these. These are my new favorite things, right?
Oh, I like those.
They're so good. I love them, right? Okay. So this sole, like, it's much like it's
Yeah.
much, there's more padding with this
Yeah,
than
then there
with
is with
that.
those.
You
Yeah.
know, like when you go to a crossing and they've got the bobbly bits where the blind people, they can feel it under their
Yeah.
feet. In that it's agony. In this, it doesn't bother me.
Right.
Yeah. These, I want to say they're called a Chelsea boot. I'm not going to lie, these are 180 quid, right? But they last forever. And if something goes wrong with them, then they will repair them for you.
So what make are these then?
They are Vivo.
Oh, okay, Vivo. Okay.
Vivo barefoot.
Yeah. Right. Yeah.
And these are my treats for myself this winter, and I swear to you, I've not taken them off other than wearing my trainers.
Do they come fairly true to size, Becky?
I would say yes.
Yeah.
Yes. And because they got a wide toe box, you know, like, so sometimes these are a size 6 and some of my shoes are a size 7 so that my foot's not squashed. I would say for barefoot, I just buy size 6. It seems to be the right size. But with this brand, if you weren't sure, order 2 sizes and send the one back that's not the right one, particularly if you're gonna wear an insole inside it. That makes a massive difference. But now I've gone barefoot, I don't think I could go back. And I really, you know, like I can't help but check people's footwear out because I'm a sado. And pretty much every gym trainer I see people in, because I'm working in gyms a lot, I'm like, oh my gosh, it's just ruining your foot. And then a lot of gym trainers have ridiculous heels. So some of them, people's feet are like that. And what that's doing is it's loading your toes and putting so much stress and making your bunions worse by tipping you forwards. So Inez, for you, it would be nice to work out, why can't you be flat? Like, what is it that's stopping you from being flat? And then it could be that your calves are really tight, for example. And maybe your plantar fascia, the underside of your foot, is tight. And then my message would be like, right, well, we've got to work on the flexibility of that until you feel more comfortable.
Yeah, I mean, I've got shocking, you know, balance and everything. And they fused my big toe because I had bunion surgery. They fused the big toe to the joint, you know, to the next bone. So I don't have that range of movement in my toe anyway. And I think that's just made things worse. I mean, it's the worst decision I ever made was having them done.
Oh, it's so hard, isn't it? It's so hard. It does impact your biomechanics. It does. It's so tricky. One thing you can do to strengthen your feet, other than wear a wider toe box, is to buy some toe spacers. That's something that we're going to talk about in the foot session, Wendy. And they're like just silicone spacers that go, like, you know, when you have a pedicure, kind of like that. But they loop around the ends, so you're not having to hold them in. They just sit there. You push them right down so they're as high up on your toes as possible. And what they do is they pull your toes apart like that. And you don't wear them in shoes. But say every evening you sit down and you do something seated, like watch the TV or whatever you do of an evening after dinner. You wear them then. So you pop them on. Yeah. And the first time you wear them, you when you start wearing them, you don't weight bear. So you wear them when you're sitting. Right. Or you could wear them in bed for a bit or whatever. Yeah. And you gradually increase the time. So the first time I wore them, because I wasn't barefoot wearing then, my toes were more like this. And my feet ached after 5 minutes because they are pulling these bones apart in your feet, and they're stretching all the little muscles, which is great because it will give more space for those muscles to develop and strengthen. But your foot will literally ache like you've done a workout. Like, so you just start 5 minutes, but you're not weight bearing. Once you can happily stay there all evening when you're off your feet, that is, with them on, then you could try to potter in them. Yeah. So walk out to the kitchen or make a cup of tea and see, can you tolerate them barefoot or not? And that would be something to work up towards. Yeah. So Inez, for you, like maybe you just wear them on the sofa to start with. Yeah. And then you think, right, I've got to go and quickly wipe down the kitchen side or whatever. I'm going to see, can I cope with them for, say, 2 minutes? And just see what does your body do? Like, what hurts when you do that? Is it your knees? Yeah. Is it your Achilles? Like, what is it? And over time, you will be able to create a change. Obviously, if you've got a fused big toe, we won't be able to get that joint back moving, but maybe we could get the other toes behaving a bit more normally. And the wider your forefoot, the better your weight is distributed. And that's going to really strengthen your arch and then your ankle, and then put less stress on your knees.
Yeah.
So it makes me so sad inside in a way that foot surgeons don't know this.
Yeah.
Well, there's
Like,
lots of things foot surgeons don't seem to know.
This should be this should be the first prong of attack.
Yeah,
A lot of
yeah.
NHS physios don't know this. I'm
Yeah.
like, why? Yeah.
Yeah.
So yeah, but I'm such a nerd about this subject, but it's so important. Like, yeah. So maybe that could be helpful. Any other questions, ladies?
No, just a couple, because when I did my little bit of marathon running, my one marathon, all of my toenails came off. So that must be
yeah, forward. Yeah.
Yeah, I mean, I lost so many toenails doing running.
Yeah,
So,
and we can just blame the footwear for that.
Yeah.
The irony of it. Yeah.
Yeah.
So if they did wider toe boxes with a bit more space and a little less heel, that probably wouldn't have happened.
Yeah.
So, but it's very common. Very common.
Oh, thank you. I need to dash off.
You're welcome.
Right,
I know you've got places to be.
Yeah, I mean, I do have to go, but one quick question, and I know I should know this, but I've avoided it the whole time. What make are the spiky balls?
Oh, Sissel. SISSEL.
ISSEL.
Yeah.
Ooh, actually, I've got another question as well.
Go on.
Well, I mean, I've been really lazy because after I had my flare up, I nicked my mum's high loo seat and was using the loo seat getting on because I just couldn't get up off the loo and I couldn't get up off the settee. I finally put it in the shed a couple of weeks ago because I thought, Jesus, I need to actually be getting up off the loo on my own.
Yeah.
But I still struggle getting off the settee, and I'm still conscious that I'm using my arms a lot. How should I be doing it? What should I be doing to try and strengthen my quads to get off the settee?
Yeah, I mean, so to start with, is your settee just too low? So that's the first question.
Yeah.
And because
you're quite tall, aren't you?
Yeah,
so?
you are, exactly. So we have literally bought new sofas from John Lewis that don't cripple Gareth because he's got a really arthritic hip, and now his knees are the same height as his hips, whereas before his knees were higher than his hips. And you want to see, he was like this. He's like, hang on a minute, I'll be there in a minute, and he'll just be stuck there for ages, right? Yeah. So if your sofa is very low, so sit on it and see how much higher is my knee than my hip. That's number one.
Yeah.
Okay. Right. If it's miles higher and it's not time in life for a new sofa, one of my clients bought this really like quite solid foam, like you would make cushions with, and she cut it to the shapes of her sofa cushions and put it underneath.
Right.
To give her like this much more height.
Yeah.
So that's an option, because actually for your lower back, it's not ideal to be in a soft, low chair, just for your body in general, right?
Yeah.
So as a short-term solution, I mean, like for sofas, I'm a fan of firm and high, right? So relevant to your height. So that's the one thing. We are going to cover how to strengthen your thigh muscles in this course. So we will go through that in more depth.
Yeah.
But probably one of the easiest exercises to do is a reverse sit down. Okay.
Right.
So if you are struggling with the concentric movement, you do the reverse. So how slowly can you sit down? And that will strengthen you in a way that doesn't stress your knees. The trick is you got to stick out your bum. You don't want your knees going forwards because that will hurt your knees. So just really, 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 really slowly and then back up. But start on a dining room chair, which is a far more sensible height than, say, the sofa. But you could practice it on the sofa, which is just going to be a lot harder.
Yeah.
So